Hello and welcome to a brand new episode of the Daily Debate. My name is Ahmed Nader, and tonight we're going to focus on the healthcare system here in Egypt and the ways of modernizing it for the near future, as we have seen major achievements in this field over the tenure of His Excellency President Abdel Fattah al-Sisi in the past decade. We will be heading to the main top stories for tonight straight away, as President Abdel Fattah al-Sisi on Sunday received a phone call from the Saudi Crown Prince Mohammed bin Salman. The call reiterated the strength of the historical bilateral relations between the two Arab countries. It also discussed the regional developments and means of boosting joint Arab action in confronting the challenges to regional stability and security. President al-Sisi and Crown Prince Salman asserted that an immediate ceasefire in Gaza and the de-escalation in the West Bank are imperative to avoiding any expansion of the conflict and helping restore the regional stability. And regarding the field of today's episode, President Abdel Fattah al-Sisi urged the completion of drafting the executive plans and the action paths for the Human Development National Project Bidaya for building the human being. At a meeting with both Prime Minister Mustafa Madbouli and the Minister of Health and Population Khalid Abdel Ghaffar, the President asserted that the human capital is Egypt's real wealth resource. The President was briefed on the project's components as well as the developments in the health profile, including the upgrades to Nasser Institute and the establishment of central labs at Badr City, as well as upgrading the tumor center in Salam City and the updates over universal health insurance system. Meanwhile, in another topic, the Minister of Foreign Affairs, Immigration and the Egyptian expatriates, Badr Abdulati, sent a letter to the Secretary General of the UN Security Council following the recent statement by the Ethiopian Prime Minister with regards to the fifth phase of filling the Ethiopian Renaissance Dam on the Nile River. The Foreign Minister asserted the Egyptian firm rejection to the unilateral Ethiopian policies that violate the principles of the international law, as well as the Declaration of Principles agreement signed by Egypt, Sudan and Ethiopia in 2015, and the UN presidential statement of September in 2021. The Foreign Minister said that the Ethiopian Prime Minister's statements about withholding part of the Blue Nile waters and completing the construction of the dam are completely unacceptable to Egypt. He added that these statements represent the continuation of the Ethiopian alarming approach that stirs concerns among its neighbors and threatens the stability of the region. The letter also asserted the illegal Ethiopian policies will have gravely negative impacts on the two Nile mouth countries of Egypt and Sudan. The top diplomat added that the recently rising Nile water flooding and the Egyptian state efforts helped to mitigate the effects of the Ethiopian unilateral actions in the past few years. However, Egypt will remain vigilant, follow up the updates, and keep ready to take any moves to defend its water security under the Charter of the United Nations. We will be heading to the first report of the Daily Debate for tonight, focusing on the presidential activities of His Excellency President Abdel Fattah al-Sisi over the past week. All in the upcoming report. Stay tuned.
President Abdel Fattah al-Sisi meets with the chairman of the Joint Chiefs of Staff of the United States, General Charles Brown, and his accompanying delegation. President Abdel Fattah al-Sisi received a phone call from the Bulgarian President Rumen Radev. The call touched on the distinguished cooperation between the two countries. President Abdel Fattah al-Sisi receives the Iraqi Prime Minister Mohammed al-Sudani, who is on an official visit to Egypt with a high-level Iraqi delegation. President Abdel Fattah el-Sisi receives a phone call from the Federal Chancellor of the Federal Republic of Germany, Olaf Scholz. They confirmed their commitment to enhancing bilateral relations across all fields. President Abdel Fattah el-Sisi receives a delegation from a number of U.S. congressional committees to discuss bilateral relations and the regional situation.
Welcome back. You're still watching the Daily Debate and heading to the report related to the topic of the Daily Debate for tonight, focusing on Egypt's state efforts in upgrading the healthcare system here in the country for the future. We will be having more details in the upcoming report. Stay tuned.
In its vision for sustainable development, Egypt Vision 2030, the state was keen to ensure the quality of health services provided and that all Egyptians enjoy a healthy, safe and secure life through the application of an integrated health system characterized by availability, quality and non-discrimination, and capable of improving health indicators by achieving universal health coverage for all citizens, and for Egypt to be a pioneer in the field of health services and research. The Universal Health Insurance Law was enacted in 2018, which aims to provide all citizens with access to high-quality health care services. Under it, the state established 3 independent bodies to manage the universal social health insurance system, separating the financing of the system, service delivery and quality control. Following the Universal Health Insurance Law was the establishment of the Egyptian Authority for Unified Procurement, Medical Supply and the Medical Technology Department, and the Egyptian Drug Authority. The state has developed the National Population Strategy and its 5-year executive plan, which is based on a set of access related to family planning and reproductive health, providing family planning services with health insurance, and all hospitals and government treatment institutions providing an adequate balance of family planning methods, as well as working to integrate population issues into the process of education and awareness. At the level of universal health insurance, the state has taken it as a new step in its accelerated steps to develop the health system and meet the medical needs of citizens in an integrated manner and at the highest level. The first phase of the universal health insurance in all governorates specified in it registered more than 5 million citizens, and about 51 hospitals and more than 310 health units and medical centers were established and developed, and more than 90 health facilities were approved.
Welcome back. You're still watching the Daily Debate, and I'm honored to be having with me over the program for tonight Dr. Mabrouk, the professor at the Faculty of Medicine at Ain Shams University. Thank you very much for being with us tonight.
Thank you very much. Very kind of you, sir.
Anytime. Of course, we did have, during the top stories, we said that President Abdel Fattah el-Sisi had an important meeting today with both the Prime Minister Mustafa Madbouli and the Minister of Health and Population, Dr. Khalid Abdel Ghaffar. How do you see the importance of following up on the achievements that we have had in terms of infrastructure for the healthcare in the past decade, and of course for the services that are being provided to the citizens?
Let's first assure our dear watchers and our dear audience is the important fact of maintaining the health of a population. The 2 important pillars for a successful society and a successful country is education and health. And without taking care of the health of our population, the population will be doomed, and definitely the country will not be able to progress forward. And I think that the President has emphasized the role of the health service on this aspect. Egypt has had one of the oldest NHS system, which dates even to the Pharaoh's time. At the pharaonic period of time, since Imhotep, who was an architect, an engineer, a great Grand Wazir of the important of the Pharaoh's histories, and of course he was also a physician and a wise man. And he has inflicted the system where there is a pure health service for free that are presented to the population, overlooked by the main physician of the pharaoh himself. And this system, which worked efficiently in the pharaonic period of time, has passed in period of declines, and it started to regain its status since the 60s. But there has been some fallacies. First of all, the increase in the number of population, and the second, the most important thing, is not the concentrating on the education of the population.
Yes.
What the president, or the initiative that was started in the past 10 years, which is mainly the education of the population about the health problems. Before, in the 60s and the 70s, we have had an increase in the number of, or the middle age of the medium age of the population, from the expected life expectancy from the 40s. Now it is approaching 74 in females, and so 76 in females and 74 in males.
Yes.
But this was the important point, is what is the quality of this life. And to concentrate on the quality of the life, you have to concentrate on education of the population. Propagating the knowledge of what's important is not to take only the medicine for the hypertension if you are only having a headache, or you're not going to take the pill of the diabetes mellitus only except if you are passing a lot of urine every day.
Yes.
What's important is educating the population and putting them on the right track. The importance of putting the people on the right track, to know their rights, and at the same time to know what are the basic health needs that they should, and how much they should obey and respect their physicians. This, I think, was one of the most important pillars.
Yes.
The second important pillar, which is very important, is the know-how, and of course the structuring. The infrastructure, we can build a lot of infrastructures and we can build a lot of hospitals, but we need the manpower. And the manpower is not just the physicians, it is all the people who are surrounding this physician, presenting the basic health service, including the nursing staff, the technicians, and the engineers and the medical engineers. All of these people are working in one network, which helps to improve the progress of this medical service. And for this, we have seen a great advancing step in the forming of a lot of hospitals. To build the infrastructure. We haven't seen that since the 60s. In the 60s, we have seen the building of simple units or medical units and some central hospitals.
Yes.
And this has been put backwards, of course, with the two wars that we have passed through, whether this was 67 attrition war or 1973.
Yes.
Afterwards, there has been, I don't want to say negligence of the medical service, but I think it's a standstill of the medical service. In the past 10 years, we have seen how the infrastructure, a lot of money has been spent on the infrastructure, increasing the number of central hospitals and increasing the facilities, and at the same time increasing the technical machines that are leading to better and faster results.
Yes.
And therefore, this is another important step. The second important step is increasing the number of the medical students and the medical faculties and the dentistry and, of course, the nursing schools all over Egypt, whether this is private institutes or the mother universities, such as Ain Shams and Cairo and the rest of the universities, which all have very distinguished medical schools presenting physicians on yearly basis, helping to go on the right track to present their service to the community.
Yes, Doctor, you mentioned a number of important points throughout answering the first question. During today's meeting between President Abdel Fattah al-Sisi and the Prime Minister, as well as the Minister of Health and Population, President al-Sisi highlighted that we need to be having upgrades to the Institute of Nasser, for example, the central labs at Badr City, for another example, and the tumor center in the city of SLM. So this brings us to the more important point, that we have had a lot of money pumped into the infrastructure, building roads, building cities, building a new capital, building, as you mentioned, several health units throughout the country and some central hospitals as well. But this leaves us with the main important point, the manpower, to be upgrading those centers, to be there and to be, of course, working at those centers as well. Do you think that in Egypt we have the incentives for the doctors, for example, to be staying here in the country? Because we have seen this point being raised by President al-Sisi before. A lot of the students, they get their degree and they travel to the United Kingdom, to the United States, to other countries. when will we be able to be having the incentives for the students, for the workers in this field, to be staying here and to be having a better quality of living?
As you are able to educate the population about their rights,
Yes.
about how they should deal with their chronic illness, whether this is diabetes mellitus or hypertension or the virus C or all this, we have also to educate the population as the importance of the manpower. We have to show our respect to the medical profession as a whole. We have to see our physicians put in the place that they deserve, which is in the minds and the hearts of the Egyptians.
Yes.
We have known that the physicians have been always in this place, and we have called our physicians the wise man, or the Hakim. And even the medical syndicate is called Dar al-Hikmah, or the home of the wisdom. And the wisdom comes from one thing. The wise man is the one who knows, should he use, when should he use the medicine, and when this medicine can be a poisonous, and when this could be a healing factor.
Yes.
So we always respect wise people. It's not important that they are young in appearance, but they have the experience and they have the education. As we go further in discussing the medical education, we know that, for example, the progress of medicine in the whole world has started in the year 1939, 1940. Before that, the mean age of death was in the 40s and the mid-40s. With the discovery of the antibiotics and the great leap forward of the mechanics and the mechanical engineering and the medical engineering, we can really find how the medicine has jumped in progress. How we, for example, during the 80s when we were studying medicine, we were receiving very vague information about the importance of physical exercise, and then we find ourselves that physical exercise goes X, Y, Z, or 1, 2, 3, 4, or whatever.
Yes.
So education and knowledge will help the population to understand the importance of the physician. There was a very famous saying about the teacher and about the physician. It's an Arabic saying that says, if you treat your physician badly or your teacher badly, then you have to be patient, because you have to be patient for your ignorance and you have to be patient for your illness, because they will not help you if you don't give them the proper respect. The bleeding that is, the chronic bleeding that we are seeing, that our national carrier, for example, as you have kindly shown, the national Egyptian carrier is going to London 4 times a day and 2 times to other cities in the UK, entitling us to know how far we have lost a lot of our children and a lot of our colleagues who are working in a very clever way and putting on their young shoulders the NHS of Britain, and how the NHS of Britain is surviving on the work of the Egyptian physicians over there.
Can we reach the level of that?
Yes, of course, definitely. Definitely. If you give the incentive, if the people give the proper respect, and if the students and the junior doctors see and a good example and see how appearance, how they are given the respect, the due respect, and the proper education. The proper education I'm not worried about, because we have generations of professors in our distinguished universities who have received their education in other foreign countries and come back to Egypt to give their service. Still, the number of physicians for every 1,000 human being in Egypt is less than the international level in advanced countries. And this can be solved. This can be solved by giving them the proper, I shouldn't say the money incentive, but money is also a part. We cannot say that the physicians are saints, they have to work for free. But at the same time, the physicians have special character.
Yes.
Because nobody knows, even when he goes to medical school. That's what I teach my students in the medical school. If you want to be a millionaire, you have to quit studying medicine, because medicine will make you live a decent life, but it will never make you a millionaire unless you become a businessman. So the idea of, and the people accept that, the medical students accept that when they decide to go for a long study of 7 years of medicine, when they go and study for a master's degree and then a PhD or MD, and they reach their qualifications only about maybe 12 to 14 years after graduation from their school, from their secondary school. This gives an idea of what long track they are taking, and how should we help them in this track on the money level and on the education level. Now these students and these young people will definitely stay in their country.
Yes, Doctor, as a professor at the Faculty of Medicine at Ain Shams University, and you've mentioned another important point, that the increase of the number of medical students, that's a good thing for the future of the country. But I would like to ask about, you mentioned that there is Cairo University, for example, Ain Shams University, but what about the private institutes, the private universities? Do you think that they will be graduating medical students with the same qualities of Cairo University and Ain Shams University, of course, for the benefit, at the end, for the benefit of the citizen and for the benefit of the system?
Let's make things clear.
Yes.
These universities have taken the permit from the presidency to be more or less non-profit organizations. A non-profit organization means that they are not after the money as much as the quality. The students are paying for the real expense for taking this tedious study, but they are definitely evaluated properly, and we shouldn't underestimate the quality of the education that they get, because they are forming a good side move or sidewalk to become physicians. And trust me, no one will get a degree from any medical school in Egypt unless he is fit or he has the degree scientifically accepted. If he fails in the exam, he will not pass. And if he fails or he gets a C or a D...
So he's not buying a degree at the end of the way?
No, you cannot buy a degree to be a physician. This is totally... You can buy degrees anywhere, but not in physicians, because this is life risk, exactly. and nobody can really become a physician in Egypt without having a proper degree and proper education and proper background. And the rules and the laws are very strict. We always hear about the people who are imitating to be doctors and how they are caught up and sent to prison.
How would you assess the amounts of investment that we have seen over the past decade under President Abdel Fattah al-Sisi in the infrastructure that is helping to be getting better services for the citizens in terms of the healthcare?
We have to talk about two prospects. First of all, the amount of infrastructure that investment has gone through. For example, you have told me about the meeting today about the Nasser Institute. Yes. Nasser Institute has been started building it under the name of Nasser, Gamal Abdel Nasser. He started building before his death, and it was not inaugurated until the mid-80s. And no renovations were made in this institute until very recently. And this shows us that a certain institute like this, which belongs to the Ministry of Health, is very important. It's very important. There is a strategy and there is tactics in any war, and our war is against disease.
Yes.
And therefore, the strategy says that you have to have strategic centers of art, or places of art of real perfection, where acting as referral centers from different governorates. You would have one big central hospital, but you have also to build other smaller hospitals which are very well equipped in different cities and smaller cities, and also advanced units that you can build on, health units in the villages. So as you go and reach the peak of the pyramid, you have to present a lot of infrastructure in every one step or every module of this system. Going through these different modules will lead you in the end to have a perfect system. There is nothing called perfect. Perfection only happens in heaven. But what we are seeking for is that the people understand how it is important to work in a system, how the system has to be self-corrected itself, and how we can reach the points to refine it every once in a while. Meetings like this on the high strategic level of the government the President and the Prime Minister and the Minister of Health, all these on the strategic, very highly strategic level, will sieve down to the different levels of tactics, and therefore the administration will go on properly, leading to self-correction. The self-correction has to be done every day, and that's why, for example, if you are asking me about the NH system, there are a lot of administrators in the British system which is responsible for organizing the stuff. Egypt has done a great, marvelous job in the past 10 years, and I was an eyewitness on that, on improving the waiting lists for surgeries.
Yes.
And it has done a great advanced work.
That's a presidential initiative.
Yes, and also one of the most important presidential initiatives is dealing with the chronic illnesses, whether this was the hepatitis C or whether this was the diabetes or hypertension, and the most important of all is the cancer. And if you see how patients who are really are not able to afford to take very expensive medicines, and I know for myself a patient who has had difficult cancer to treat, and his capacity of money is not capable of supplying the enough money for paying for this, and the government paid for him in spite of the fact that he was a retired businessman who had no medical insurance, but he's an Egyptian citizen, and therefore he's receiving a medicine that is very expensive, and he was not able to afford it, but the government is supplying that. This gives us and shows us how important is the human being and the citizen for the administration, for the government, and for the president himself.
Yes, Doctor, allow me to be going to the other report of the daily debate for tonight, focusing on the Egyptian Healthcare Authority announcing strategic international partnerships for the modernization, for the mechanization, and of course for the future of the healthcare system here in Egypt. We'll be having more details in the upcoming report about the digital transformation in this field, in the field of healthcare for the future of the country. So stay tuned.
The Egypt Healthcare Authority has announced strategic partnerships with international sponsors for the mechanization and digital transformation of services and revenue cycle management in its healthcare facilities. Head of the Egypt Healthcare Authority, Dr. Ahmed Al-Subki, Supervisor General of the Universal Health Insurance and Haya Karima projects at the Ministry of Health and Population, said they are cooperating with international sponsors to provide technological and innovative solutions for healthcare, for mechanization and digital transformation of services, and for managing the revenue cycle using the latest innovative technologies. Subki added that the community participation and concerted efforts are crucial to ensuring the provision of outstanding healthcare services and achieving the Sustainable Health Development Goals 2030. The strategic partnerships are to exchange expertise, knowledge and successful experiences and cooperate in the mechanization and digital transformation of services at its healthcare facilities in the provinces covered by the Universal Health Insurance System. The sustainability of providing the best health services will offer innovative solutions for developing medical systems and improving the quality of care provided to patients. This cooperation aims to apply the latest technologies in managing health services and ensuring the efficiency and effectiveness of treatment operations. Subki affirmed the importance of community participation and the convergence of efforts of all institutions and sectors of the state to ensure the provision of outstanding health services in line with the vision of Egypt Healthcare Authority and the goals of the Universal Health Insurance Project, aiming to achieve sustainable health development and enhance economic growth according to Egypt's Vision 2030.
Welcome back. You're still watching the Daily Debate, and I'm honored to be having with me over the program for tonight Dr. Mabrouk, the professor of the Faculty of Medicine at Ain Shams University. Thank you very much once again for being with us tonight. We were speaking more about the services provided to the citizens. How do you see the importance of the initiatives, the presidential initiatives that we have seen over the past decade that are being provided to the citizens until now?
It definitely has improved the quality of life. The quantity of life has not improved. We're talking about 74 and 73 in ladies, in females and males, but what's important is the quality.
Yes.
Before this initiative, the people, once they get in their mid-50s or their late 50s, they will be suffering from being overweight, suffering from hypertension, from diabetes, and from, if they had the hepatitis C, and therefore they will be more or less handicapped part of the population.
Yes.
Their final 20 years in life will be a sort of handicap, staying at home and doing nothing or acting as a burden on the rest of the family. With the progress of Haya Karima and the progress of early discovery of illnesses and the management of these illnesses, the prospect is improving the quality of life. To improve the quality of life will make you able to make this part of the population active, working, and even if they are doing the household activities, then they will not be needing any help, and therefore they will save. The extra help needed is for other things that other population to work with. So when we talk about this particular aspect of improving the quality of life, this is a very important aim and a very important task to be fulfilled, and quite difficult. The second important point which the President has concentrated upon is the population.
Yes.
The population, as he was saying, that we are having a problem of the extensive, or we would like to say the population explosion. The expression when used is really can be very much alarming, because the families are the couples, or the newlywed couples are having 3, 4, 5 or sometimes 6 children, and therefore this will put burden on the schooling system and the health system and the proper economy of the whole country. And knowing that we are a valley, even if we expand ourselves outside the narrow Nile Valley and go to the desert with a lack of water over there, still the population will not be a highly educated population. But therefore, improving the quality of the population,
yes,
by definitely decreasing the number of children. The good family planning, if it is being fulfilled, and therefore the Ministry of Health, it's called the Ministry of Health and Family Planning and Population. The family planning is very, very important. Teaching the newly married couples of how it is important to supply the society with healthy, capable children of surviving and competing in the market of education and work 20 years later. This is how it goes. This is the important prospect. Perhaps we have concentrated the past 10 years on the improvement of the health of the population.
Yes.
But still the other arm, the President has in his latest talks within the past year, and I've been watching, has been concentrating on the population expansion and the population explosion. It is a blessing to have a young population. It's a blessing when you look, for example, as highly modern societies like Japan, which are trying, or even Singapore, which is one of the emeralds of the East, yet they are suffering now from the fact that the population, or the young population, is diminishing and the aging population is increasing. We don't have this problem in Egypt. Therefore, it's a trophy to have a young population. But at the same time, it's a very big task on the shoulders of the government and of the President, how to use this power in the right place, and how to convince the population that you have to be wise in your decision and making sure that you are going on the right track on maintaining a good family planning. And definitely the family planning is one of the most important pillars of a good health system.
That's a very significant point, to be convincing the population. This means that there are efforts by the political leadership, by the President Abdel Fattah al-Sisi, by the cabinet under Prime Minister Mustafa Madbouli, and of course the Minister of Health and Population, Dr. Khalid Abdel Ghaffar. So there are efforts by the political leadership. On the other hand, how do you see the response by the population, by the citizens? Do you think that there is a change in the mindsets and the culture of the Egyptians?
I'm sure. You see, we're living now in a small village. It's not the world anymore.
Yes.
And sometimes the family planning tools or the contraception measures are not available or not sieving to the right target population.
Yes.
But by reaching this target population, by making it available, then you will be winning 50% of the war, of the battle.
Yes.
Which is to get a good product. And a good product here is 2 or 3 children are really, you can feed them, you can educate them, and you can put them on the right track to be a real part of the arsenal that Egypt has.
Yes.
to build a society. Some countries are saying if we are having 100 million, then we are having 100 million brains and we're having 200 million arms. Yes, this is correct, but still you need to have the sharp brains and the sharp arms, and for the sharp brains and the sharp arms to have, then you need to have the proper education, and you cannot supply proper education if you are lacking the funds. So it's very important when the people find that the tools of family planning, of contraceptive measures are available and sieved through all the units of the healthcare system that are found on the 4,000 villages of Cairo, of Egypt, then you will be definitely on the right track.
On the other hand, how do you see the importance of the universal health coverage system that is being incepted here in Egypt over the past decade, and how do you see the future of it, because it has been implemented in several governorates like Port Said, for example.
Port Said and Suez and Ismailia are on the right track to do this medical insurance. Definitely this is a very important network, a very important umbrella that's going to cover the population. And still, to fulfill that dream in a heavily populated city like Cairo, that's a very big dream that has to have the complete coverage by other health institutes, not just the Health Ministry of Health, but also the university hospitals, which we have about 3 or 4 in Greater Cairo, and of course a lot of private hospitals will be also involved in this healthcare system. The prospects are a lot, the challenges are huge, but still hope is present.
Is the main problem the lack of money? Do we need more money just to be implementing and to be executing the universal health coverage system in bigger governorates?
Definitely. Definitely.
It's just about the money.
This is definitely a great issue. The organization, the Egyptians are capable of organizing a lot of things, but definitely the material supplying or the money supplying is very, very important. And therefore we go back to the same point. If you are having a huge population, then you have to present the service to a huger population, and therefore you'll spend a lot of money allocation.
Yes.
And you cannot stop the spending, but definitely you have to be very cautious in your planning.
And this gets us to another important initiative that we have seen over the past decade, and of course we have seen the implementation of the first phase of it, and anticipating the second phase of it as well is the Haya Karima, the Decent Life initiative. How do you see the importance of this initiative, not just on the medical level, but for as the quality of living that is being presented to the citizens there, because it is serving thousands of villagers, millions of Egyptians living outside of Cairo and Alexandria and the bigger cities?
Well, definitely this is a great accomplishment. It needs a lot of support, and at the same time a lot of organization, and definitely to sieve. The important thing is one of the things that we have seen in the early 21st century, was that there was improvement of the prospect of money-wise, but the distribution was not fair. At the same time, it was not sieving to the younger, to the impoverished people. Now we see how Haya Karima is trying to reach the impoverished, how it's trying to supply that. In all the challenges that we are facing with the situation in the Middle East and the economic situation in the world, definitely there are a lot of challenges, and therefore I cannot envy the president, but I have always to support him.
Do we need digital transformation in the medical field here in Egypt?
Definitely, especially in remote areas, but I don't believe very much in proper diagnosis using digitalization, because sometimes you need to be present, and therefore It has been stated that in spite of all the AI technology, you cannot replace the health workers. And the health workers have to be present. And the AI is not going to ever to work in the place of this. We are going to lose a lot of jobs in the next 20th century, in the next 20 years.
Yes.
But we're not going to lose any job in the health field, because the human communication and the human skills are always beating up any AI in the way.
On the other hand, how do you see the importance of the cooperation and the collaboration between the private sector and the public sector, as well as we have talked throughout the episode for tonight about the role of the government, the role of the political leadership, the response of the citizens. But in the middle, do you think that there would be collaboration between the private sector and the private sector?
Definitely there could be a cooperation, but definitely the private sector is always, we say, the capital are always having sort of cowardice.
Yes.
They want to make money, and they are entitled to make money. We cannot nationalize them, we cannot forbid them. We can use them, we can let them be taking some more or less minor partnership in very sophisticated procedures that cannot be done in the general hospitals or the university hospitals. And therefore they have a role, and this role can be paid for, and therefore a symbiotic relation can happen.
Yes, Dr. Amr Mabrouk, the professor at the Faculty of Medicine at Ain Shams University, thank you very much for being with us tonight on the Daily Debate.
It's a great honor to me. Thank you,
Anytime.
sir.
And this brings us to the end of the Daily Debate for tonight. Thank you for watching, and goodbye.